Good afternoon, everyone. We are going to give folks probably 30 more seconds to log in. The number count is going up. Okay, let's go ahead and get started. I want to say good afternoon to everyone and welcome to the 2024 Rural Health and Safety Education Grants Program RFA webinar. So glad you could join us. Before we get started, I want to cover a few meeting logistics. First, the webinar is being recorded. So please mute your mics. I don't think that's going to be an issue. I think we mute on our side, but if you have any issues, there is a tech support number here for you. Throughout the webinar, you may have questions that come up. We are going to be collecting questions in the Q&A box, not the chat box, but the Q&A box. So please enter any questions that you have in the Q&A box throughout the webinar, or as we get to the Q&A section at the end. Some of you may have questions that are very specific to your proposal, and you may want to reach out to me directly. Feel free to do that after the webinar. So the slides and the recording of this conference or this webinar will be available on the Rural Health and Safety Education Program page. Here is the link here. So that will be made available after the webinar today. You may want to give us a day or so to get that up and posted. Next slide. So need to cover our non-discrimination statement. Bear with me. I will read this first bullet and then quickly summarize the second two bullets. In accordance with federal civil rights laws and the U.S. Department of Agriculture civil rights regulations and policy, the USDA, its agencies, offices, and employees, and institutions participating in or administering USDA programs are prohibited from discriminating based on race, color, national origin, religion, sex, gender identity, including gender expression, sexual orientation, disability, age, marital status, family, parental status, income derived from public assistance programs, political beliefs, or reprisal or retaliation for prior civil rights activities in any program or activity conducted or funded by USDA. Note that not all bases apply to all programs. Remedies and complaints filing deadlines may vary by program or incident. The second bullet here just lets you know that persons with disability may request accommodations, and those who need any type of language interpretation or translation other than English, we can make that available as well. The third bullet just gives you information if anyone feels like there is a discrimination issue and want to file a complaint. There is contact information to file that complaint with USDA. Next slide. So let me introduce myself real quick. My name is Edwin Lewis. I am the National Program Leader here in the Division of Family Consumer Sciences in NIFA. I am the National Program Leader for the Rural Health and Safety Education Program. You'll also see in our screen here, co-presenting with me today is Sydney Nowlin, who is our program specialist. And again, she will be co-presenting here with me today. Next slide. So just want to give us a big brief overview of what we'll cover today. First, we'll do a NIFA overview. We'll also do a program overview. And then Sydney will cover requests for application details, proposal evaluation, and then we'll share a few additional tips and tricks and additional information and resources. And as time permits, we will wrap up with Q&A at the end. So again, remember to put your questions in the box, in the Q&A box. Want to Also, I'm going to do this now, is drop a few links in our box, in the chat box, that is. Not sure how that may not have come up with the links. So they're also going to be on one of the later slides here, but let me make a note of this real quick. In the RFA, there is a link to the grants application guide. You can go to that guide. Again, there are links in several places in the RFA to find more information about the application process, things that should be in your proposal. And so that's just one resource. The other resource is our policy guide. So in that policy guide, you'll find a lot of information, including answers to some of the questions you might have regarding allowable costs. And then I think the last thing that I dropped in the chat should have been an email address for our awards management division. So if you have questions regarding things, again, like allowable costs, our awards management division can assist you with that information. So real quick, just want to cover a little bit of a NIFA overview. So the National Institute of Food and Agriculture is the extramural science funding agency within USDA's research, education, and economics mission area. NIFA invests in and supports research, education, and extension initiatives that ensure the long-term viability of agriculture. And NIFA provides funding and strategic leadership for programs that ensure groundbreaking discoveries in agriculture-related sciences and technologies to reach the people who can put them into practice. Next slide. So again, NIFA covers a wide array of topics in terms of our grant programs. I am not going to read all of the topics that we cover, but again, you can read through here. You'll see animal science and natural resources, education programs, human sciences, plants, etc. So visit our website. You can click on the links on our website to any of these topics. You'll see grant or funding opportunities associated with all of these topics. Next page. Before we start the program overview, want to make an important point here. The RFA for Rural Health and Safety Education was originally published on January the 11th. On January 23rd, a modified RFA replaced that RFA both on grants.gov and on the Rural Health and Safety Education website. You'll know that you have that RFA because at the very top, you'll see red letters, red font, noting that this is the modified RFA. So if you are one of those who quickly pulled up the RFA after it was published and you have not been back in, please go back in, access the modified RFA. There are a couple of requirements that Sydney's going to cover later that are also throughout that RFA highlighted in red font. So again, grants.gov and our website has the modified RFA in red font, at least the parts that have been changed. So real quick, just want to cover a brief overview of the purpose, priorities of the Rural Health and Safety Education Program. This program seeks to support quality of life in rural communities by addressing the relationship between rural prosperity and rural health and safety in the context of food, agriculture, natural resources, and human sciences. Next slide. For the past few years, including this year, the Rural Health and Safety Education Program has and will continue to focus on individual and family health education, which prioritizes putting health information into the hands of rural residents, empowering them with education to realize their own optimal health, as well as training those serving the health needs of rural communities, especially through partnerships. Proposals must align with at least one of the 5 objective areas listed here. They're also on page 7 of the RFA, so I will not read them, but I will emphasize again, and we'll share this later, that this is based on health education and information. And again, we'll share later that this is based on kind of an extension model. Next slide. Consistent with the 2018 Farm Bill, and some of you know that the Farm Bill has been extended 1 more year, but consistent with the current Farm Bill that we're operating under, we're continuing to encourage, but not require, but encourage projects implementing new or established programs or approaches with demonstrated evidence of impact that focus on prevention and or reduction of opioid and or substance use and abuse. And so again, we are encouraging that. That is a priority area, this focus on opioid misuse and abuse. But again, we are also accepting proposals that are focused on other priority health issues in rural communities. In terms of priority approach, we are still soliciting and encouraging proposals that utilize telehealth and telemedicine and distance learning strategies for opioid and substance education and training in rural communities. Next slide. Eligible institutions. The eligibility for this program is limited to what we call land grant institutions or land grant universities. The 1862, 1890, which are historically Black colleges and universities, and the 1994 tribal colleges, land grant universities. If you're on the call and you're not sure if you are a land grant university and if you're eligible, feel free to reach out to me or Sydney after this call, and we can help you identify and determine whether you are eligible or not. However, bullet 2 here is you can subcontract with institutions that are not eligible. So you can contract with other types of universities or community-based organizations, et cetera, to implement your project. The key is making sure those entities are playing a meaningful and substantive role in the project. Next slide. Award limitations. NIFA anticipates making multiple awards in 2014. I will note that we are still in continuing resolution, and so we are operating off of the FY23 appropriations. And so again, this is what we're anticipating in terms of a funding amount for FY23, but we are still awaiting the passing of the final appropriations. So in the last 2 years, based on our appropriations, we funded about 13 to 14 projects to kind of give you an idea of the range and number of projects we historically funded. Again, in the previous year, FY23, we had an appropriations of $5 million. And still this year, our plan is to fund at a maximum each ward no more than $350,000 for a 3-year period of performance. Next slide. You'll see this in the in your application and in the RFA, that the project type that you will select, identify, is an extension project type, and the grant type is a standard grant. One of the questions that we often receive, since we are limited this to extension project types, does the PD have to have an extension appointment? And the PD does not have to have an extension appointment, but we are asking that you operate under extension model, which is based on community-based education and engagement. Next slide. Project requirements. So again, listed on page 11 and 12, I believe, of the RFA. Here are some of the requirements for any proposals that we are going to fund. They must implement research-informed, outcome-based programs and approaches. They must utilize, and we just made reference to this, a cooperative extension as a mode of program outreach and delivery. They must serve rural areas, and in the RFA, there are some links to some resources that will help determine and justify the program or the communities that you will be serving, that those programs, those communities are indeed classified by these resources as rural communities. And you must solicit community buy-in regarding the issues and project approaches. And so we encourage you, really require you to go out and engage with the communities you're serving to have buy-in that the health priorities you have identified and will be addressing, that community has also identified those as priority health issues to be addressed. Next slide. Is that the next slide? It is the next slide. Sorry about that, Sydney. So the next slide here, just some additional requirements. Plan for coordination of the program, the State Office of Rural Health, and appropriate programs of Department of Health and Human Services. This is a legislative requirement, so make sure you plan for this coordination. In terms of reporting on performance, projects are required to develop and report on performance indicators that demonstrate measurable changes in knowledge and attitude of project participants. Projects seeking to also capture behavioral change is highly encouraged. These indicators should demonstrate that the project's success at achieving objectives of the proposed project and overarching goal of the Rural Health and Safety Education Program. So NIFA encourage that you involve your evaluators upfront in the planning of your proposals. G, there is utilize a theoretical and practice framework to guide program development, implementation, and evaluation. So projects should identify an existing framework or model as a guide for their programs, health education and capacity building focus, and their extension outreach strategy. The framework model must recognize the complex bidirectional relationship between individuals, communities, and social factors. And then finally is dissemination of information. So make sure you have a clear plan for how you plan to disseminate information generated as a result of your project. Next slide. Thanks, Sydney. Now, these are project recommendations. Collaborate across extension program areas. Include content experts from across academic and clinical domains. So within your university, you may be reaching out to the College of Medicine or the College of Public Health. C, design projects to include policy, systems, and environmental change strategies. D, implement adaptations to existing evidence-based programs. And E, promote principles of health equity and creating a culture of health, for example, factoring in social determinants of health. Next slide. A few additional recommendations. Promote community empowerment as a tool for sustainability. And again, we just talked about engaging with your community leaders and folks in the community around both the issue and the approach you're taking. Increase professional capacities to engage in health leadership in rural communities. H, increase public access to new ideas and technologies. Increase public health knowledge and engage local and state health systems. And then finally, increase the utilization of telehealth, telemedicine, and distance learning strategies for education and training. Just want to cover a few good practices for you to be aware of. One, know your audience. And in your application, define who and where they are and what it is they need. Also describe how you will engage, educate, and assist the community. Propose a solid plan of work. Make a compelling case about the need that you're addressing. Your proposal should be ambitious, but yet achievable. Use recent data. Avoid duplication of projects for that same community. And plan promising, powerful partnerships. Next slide. And another good practice is to do your homework. And we have a tool on our website that can help you with some of your homework. And that is a list of abstracts from previously funded projects. And so here's a link here. You can also go on the NIFA website onto the Rural Health and Safety Education webpage, and you will find this link, and it will take you to a page like this. Our projects actually, the abstracts actually start with 2023, and we'll go all the way back to, I believe, 2007. So if you're interested in what we funded previously, what kind of models have been used, etc., feel free to visit our webpage. Another tool again for doing your homework. So application activities that will not be funded. Applications without a plan for measuring participant outcomes. So again, important to involve your evaluators early in the process and plan for clear metrics and how you will report on these outcomes. Your application should be planned for 36 months, a 3-year period of performance. Applications must focus on topic areas specific to, we will not fund applications that are focusing on topic areas specific to other programs. And we give examples here of agribility, for example. So if you're submitting programs and the focus really is on targeting farmers and ranchers with disabilities and providing assistance for them, that may be determined to really be an agribility project or Farm and Ranch Stress Assistance Network. And so if your project is specific to suicide prevention for farmers and ranchers, that is a project that we are supporting under the FARSAN network. So again, we'll be looking for those types of things. So we don't, in other words, we don't want to use rural health and safety education to navigate away from programs that have been specifically created for the target audience and purpose that you may be targeting. Applications with a focus on research. We are not funding research. Formal education, K through 12 or university, or clinical interventions, for example, diagnosing or treating mental disorders. Well, that's not what this program will be funding. And then lastly, applications focus on clinical treatment of individuals with substance use disorders. The last thing that's here that I want to clarify, and I've received this question a number of times, in the RFA, it makes reference to multiple submissions. So we will consider multiple submissions from a university, but not multiple submissions from the same PD. So just want to provide that clarification. So multiple applications from one institution, different PDs. So no applications from the same PD. All right, Sydney, next slide. And then cost sharing and matching. As some of you might know, some of our programs require a match. Rural health and safety education does not have a matching requirement. If you decide to do so, that is fine. That's great. There is not a system in place in this program that will reward you or give you extra points in the evaluation process for providing a match. So again, just want to make that clear. No match requirement. And if you decide to match, there is no evaluation criteria that would give you a leg up for that match. So at this point, I'm going to turn it over to Sydney to address application details and documents.
Thank you. So I will be talking about application details and the documents associated with your application. So we do want to note that application changes from prior years, that we have recently extended the period of performance from 24 months to 36 months, and that began last fiscal year. And proposed budgets must cover the full 36-month period of performance. So the RFA is available in 2 locations. Of course, grants.gov, which is what you will utilize to apply. The RFA can also be found on our website under funding opportunities, and those are the links there on the screen. And as Dr. Lewis alluded to earlier in as we began, that we did modify it. And the modifications are in red and posted on both our website as well as grants.gov. So please check out the new and updated RFA. The application deadline is still March 14th, 2024 at 5 p.m. Eastern time, and it must be submitted through grants.gov. So start early. We do not accept email applications. Remember that we have approximately $5 million in funding. Don't forget to put the program code, which is LX, and please, please, please keep in mind the maximum funding per award is $350,000. Key documents that are associated with your application. Those are the project summary or abstract, a project narrative that includes your logic model and timeline, a bibliography or reference list, your data management plan, and there are some other documents that are going to be required, and you can take a look at those in the RFA and the NIFA grant application guide that is linked here. And I also was able to get it populated in the chat. So if you do not see it, please let me know. I know some of you didn't see it at first, but we got it in there. A few more details about the application. Your project narrative is limited to 24 pages, and this is strictly enforced. Double spacing, 12-point Times New Roman font that includes your text, any tables and figures that you decide to put into your project narrative. Single spacing is okay for those things in the tables and figures, because I know it may look a little wonky when it's double spaced. Within that 24 pages, you need to describe a list of headings of information that are required in the narrative that can be found in the RFA. The impact on research, training, infrastructure, or extension activities to achieve the project's goals, and cooperation with institutional involvement, as well as your project timeline and logic models. Any applications that exceed that 24-page limit will be returned without review. You will be disqualified from moving to the peer review process. The data management plan. This is what was updated in the RFA, and those changes are highlighted in red on the new RFA that's posted to grants.gov and our website. The data management plan, the project directors must provide detailed, provide in detail business and management plans that include the type of data that you expect, the data format, data storage and preservation process, your sharing and protection and public access to data, and the roles and responsibilities of that data. And there's more information there at that link that you can check out for more information related to the data management plan. Application submission. We only accept electronic submissions of applications via grants.gov. The application documents, so that is your application and all associated attachments that go with that, must be in PDF format, portable document format, in order for NIFA to accept this. So that is your narrative, your budget justification, any resumes or CVs that go along with your application must be in PDF format. Grants.gov does allow for other formats to be uploaded. However, we at NIFA do not accept applications that are not PDF format. And do not use third-party PDF builders. Now let's talk about the proposal evaluation process. So the proposals will be assigned for review to at least 3 reviewers with expertise in the proposed topic. Those reviewers will produce individual reviews of each of the proposals, evaluating strengths and weaknesses of the evaluation criteria outlined in the RFA. Those written reviews will then be used to begin panel discussions with other reviewers serving on the same peer review panel. Through these discussions, the peer review panelists will come to a consensus and provide a final rating and ranking of each of those proposals that were reviewed. And here is the evaluation criteria that can be found in the RFA on pages 24 and 25. And these should be headed in your project narrative. So make sure that you cover issue statement in your planned approach, objectives, activities, outcomes, and timeline, the division of labor, a project performance assessment plan, your management plan, budget and budget narrative, project communication and dissemination, and sustainability. And for those of you that might be listening to this webinar and decide that either this is not a fit for you or maybe not at this time that you are going to submit an application, we welcome you if you're interested to become a proposal peer reviewer, or if you want to review for other programs. There is a website that you can go to submit your recruitment, and there's to volunteer, there is a link here. We select the panelists based on their expertise, credentials, and the panel's needs in general. And if you have a specific expertise that's needed, you will be contacted by that given a national program leader. And so this is what the website is. It's prs.nifa.usda.gov, and you can visit the panelist recruitment link if you would like to volunteer to become a peer reviewer. So a lot of people wonder, what is the timeline looking like for competitive programs? This program closes March 14th. So what does this look like? So it takes about 1 to 2 months. The RFA is released. Proposals are due. That's the writing time. So then after that March 14th deadline, we'll start the peer review process. The proposals will undergo peer review, and proposal funding notifications will be sent out at the 2 to 3 months post that March timeframe. And then after those, they go to our awards management office, and they take about 1 to 2 months before awards are finalized and made. So on an average, a competitive program like this takes anywhere from 3 to 5 months from the proposal due date to an actual award being made to an institution where they receive an official award face sheet. We try to keep everybody updated as much as possible, and we just greatly appreciate your patience in this process. So that will conclude the application details and evaluation criteria, and I'm going to turn it back over to Edwin to cover some tips for success.
Hey, thanks, Sydney. So just want to cover just a few more things. One is tips for success. So the first thing is excite the reviewers. So we'll have a group of panelists peer review panelists who will review your proposals. They're responsible for making funding recommendations to NIFA. So that group of reviewers will review anywhere from probably 7 to 9 proposals. So you want to make sure that your proposal is exciting, that it's well written, it's succinct, it's logical, easy to track as they're reading along. Make sure that you're addressing an important challenge and that you clearly define that challenge and our problem in that rural area. And then take an innovative approach. Don't just duplicate what others are doing, but be innovative in your approach. Have a solid and detailed plan for identifying the needs, your program development, and your program implementation. And then we've mentioned this a few times, but have a solid, detailed evaluation plan where you can report out outcome-based, your outcomes and your metrics, et cetera. So evaluators are very important. Next slide. So some do's and some don'ts. So please don't make these errors. Missing parts or documents. We will do an initial review of the packages before we send them to panel. And unfortunately, some applications are disqualified on the initial review because they are missing required documents, or they are not in PDF format, as Sydney mentioned, or they're over the page limit. So make sure that you are clearly aware of the page limit and you're staying within those page limits. Budget limit. There is no strategy for proposing higher than what the program allows. Matter of fact, you will be disqualified if you submit proposals for $400,000, $500,000. The cap is $350,000. And then no late submissions. I would plan to submit a day or two early, at least. Too often we have folks who are trying to submit minutes before, have technology challenges, and we are not able to accept those proposals that are submitted or come in to NIFA 1 second after the deadline. So submit at least a day or two early. And these are just fatal flaws. Just want to highlight these because, again, these are fatal flaws that will get you disqualified up front and won't even make it to panel. Do's, and this is some big ones. Just have someone to read your proposal. I know your colleagues are busy, but finding someone who can review your proposal, make sure that it is clear. They can ask questions that you may want to consider and look for other flaws. And make sure you address those things before you submit, because once you hit that submit button, we have them. So try to do that up front. And if you can, for quality control's sake, have someone to review ahead of time. A few other tips for success, and these are really, this is feedback from our panelists in the past. And so our panelists have made comments such as the proposal's vague, unfocused, or poorly presented. The audience or impact is unclear. It's not well justified. Insufficient reviews of other projects. So obviously they haven't done their homework. Work plan is not clear, or it's not logical, or it's not detailed, or it's too ambitious. It's not with the time frame that they're looking at, the budget they're looking at. This project is not achievable, does not appear to be achievable. Project director or the teams and partners you recruit do not appear to have the appropriate expertise. Again, that goes with the next one, weak collaboration, or your management plan seems to be poor. Lack of letters from consultants, partners, etc. As you read through the RFA, you will not see a requirement for letters of commitment. However, many of the strong proposals often include letters of commitments from those who are going to be partnering with them. So this goes back to one of the earlier points that the reviewers are going to be reviewing 7 to 9 proposals, and letters of commitment from those you're going to be partnering with strengthens your proposal. And then the last one here, unclear what difference the rural health and safety education funding is really going to make. They're duplicating what what someone already did in this community, or it's unclear what the potential impact is really going to be. Next slide. A few more additional resources that we just want to highlight. Encourage you to go on the NIFA website and check out our events calendar. There's the link there, the URL. On there, you'll see list of webinars and other events. We have a big grantsmanship workshop coming up in our annual virtual grantsmanship workshop that covers all of NIFA programs. That's coming up soon. But going on our website to check out the upcoming events gives you access to a lot of great resources that's coming your way. And then the second bullet there is our RFA calendar. So if you're interested in knowing what calendars are or what RFAs are in the pipeline, check out the calendar. Won't go through all of these, but some of these are the same resources that we dropped in the chat. All of these resources are on our website. And so a lot of great resources to strengthen your grantsmanship and your opportunity to be successful at applying to NIFA funding opportunities. So again, make note of this. Again, we'll be posting the PowerPoint and the webinar on the website, so you'll have access to these links. Next slide. And at this point, we will turn back over to Sydney to facilitate any questions that you might have.
Yes, so we have a few questions in the chat. A couple of them I have already answered. And just for the sake of everyone, a question was asked, can the period of performance be less than 3 years? The answer is no. It must be the full 36-month period of performance. Another question came in, are co-PIs allowable? And yes, the answer to that is yes. So let's move on to the next question. So only educational institutions are eligible as a lead applicant.
More specifically, not just an educational institution, but yes, universities, but specifically classified land grant universities. And if you're not sure what those universities are, we actually have a list of land grant universities on the NIFA website. Again, if you are not sure whether you are eligible as a lead applicant and you can't find that information on our website, the list of land grant universities, we actually have a list and we have a map of the land grant universities on our website. But if you are uncertain, feel free to reach out to me or Sydney directly and we will help you with that determination.
And our next question is, are COEs eligible for this grant?
So centers of excellence, again, this is kind of consistent with what we were just covering. You'll need to apply as a lead institution. The other institutions that are part of your center of excellence can be co-PIs and partners, but there needs to be a lead institution to apply for that grant. Also within the grant, you can apply for Center of Excellence status, and that is limited to those whose proposals are ranked very high in the panel. So you can apply for a Center of Excellence designation through the application process.
And our next question is, can evaluators be a program PI as well if they have experience, or does it need to be an outside evaluator?
It does not need to be an outside evaluator. We strongly encourage that whoever is the evaluator has the credentials, as you mentioned, to be an evaluator and has the history, again, the expertise to evaluate the projects.
Okay, next question. Would extension programs that take place in K-12 classroom, for example, guest presentation series, be classified as focus on formal education?
No. So I know that 4-H and a lot of local extension programs are partnering with local schools to conduct programs. And so what we're saying here is that we are not funding programs to be incorporated into K-12 curriculum and delivered as part of that, but in partnership with schools, you can deliver extension-based programs.
Okay. And the next question is, what percentage of proposals are typically funded?
What percentage of proposals are typically funded? Rural health and safety education over the last couple of years have had a fairly higher success rate or awarding rate. A little bit over, well, over 50% of the proposals over the last few years have been funded, probably a little bit more than that. But again, there's no guarantee that that's going to be the case each year. But historically, at least over the last few years, it's been over 50% of the proposals have been funded. But again, that is based on the quality of proposals, because again, we have to have proposals that the panel deems fundable. So we have been fortunate to have a number of good proposals over the last several years.
All right, our next question is, what is a PD? And that is project director. Another question, are needs assessment considered research or okay as outreach development?
Needs assessments are okay as outreach development. Again, an important part of your proposal is going to be engagement with the communities you're serving to verify the needs and document the health needs in that community and get buy-in. So that is not considered research to do a needs assessment as part of your project.
The next question is there a maximum limit on number of co-PIs?
We do not have a maximum number on the number of co-PIs. Again, your management plan will have to make sense and be strong in terms of the number of folks who you have as partners on a project. And so just keep that in mind, but we do not put a cap on the number of co-PIs and partners.
Next question, can you clarify how distinction would be made for correct funding of an application specific to prevention for rural young families for this opportunity in the CIFAR or the risk sustainable community projects funding?
That is one that you'll probably need to reach out to us separately on because we will need to do a little bit of looking at the CIFAR program and some of the other programs. We have different NPLs who lead those efforts. So being able to determine, again, what those differences are, I think we'll need a little bit of time to answer your question. So send me an email separately and we'll try to work with you on that question.
Does the PD, is the PD required to have a PhD?
No, we do not require terminal degrees, PhDs for the PD. We simply look at expertise. And so long as you can document sufficient expertise for leading the project, that is sufficient.
Okay. If our RUCC code is 2 metro, but we serve several smaller rural areas within the county, which is our project goal, would we meet the requirement?
Yeah, this is one of the challenges with some of the codes is that it sometimes disqualifies some of these bigger areas that include some metropolitan areas, and yet there's rural components to it. But right now, our program is strictly using those codes to guide eligibility. And so we are going with those codes, and in the future, we may be looking at other ways to classify rural communities that's a little bit more flexible. For FY24, it must align with those codes in the RFA.
Okay. Can you clarify whether training rural professionals in a clinical prevention, not funding the delivery of the intervention, is able to be funded as a portion of this opportunity?
Could you read that one more time, Sydney, please?
Yes. Can you clarify whether training rural professionals in a clinical intervention not funding the delivery of the intervention is able to be funded as a portion of this opportunity?
Good question. We may have to take another look at that. And but there are a number of projects, and I encourage you to go look at some of the abstracts where we have supported folks who have incorporated, because again, training of folks in the community who are serving the rural population in areas of mental health. So we have funded projects that are doing some training, such as mental health first aid, training for some of those individuals or leaders in the community have been a part of those projects. So in that case, yes, but again, our projects are focused on the education component. So if it's education focus, empowering stakeholders in the community to support health needs through trainings like QPR, mental health first aid, et cetera, we have supported projects like that.
Okay, the next question is, what is classified as a third-party PDF builder, Adobe PDF merger website? That's a good question that I do not have an answer for you to give as an example.
And neither do I. So yeah. You may want to send us a question, send us that individually, and we'll do our best to kind of get you some examples. So send us that email. Send us an email with that.
Please send us an email with that, and we can try to get some examples for you. Next question. On average, how many proposals do you receive each year?
On average, we're probably under 30. Sydney, is that about accurate? We're somewhere under 30.
Yeah, I would say on average for the past few years, yeah, we've been about under 30.
Yep.
Next question. If proposals focus on opioid prevention, will those receive priority during peer review evaluation? If so, how much weight will it hold?
So they do not. We are holding those up as a priority focus, and we are encouraging applications. However, the RFA and the process does not award additional points for focusing on that topic.
Okay. The next one is a little specific. So on page 14 of the RFI under eligibility, it says applications may be submitted by land-grant colleges and universities. Can non-land grant colleges and universities be an applicant?
The answer to that one is no. They can be partners. They can be a partner and they subawardee, but a non-land grant university cannot be a lead applicant for this program.
Okay, next question. Should lists of RUCA communities be listed out and included in the application? And also, if there is one track in the number 4 through 10, does that local area need to be identified?
Yeah, I'm actually looking back at the RFA. So you do want to make sure that you're clarifying that you have which one of these you've used, whether it's the rural urban continuing code or the rural urban community area. Listing out those codes would be helpful for the reviewers and for Sydney and I to ensure that you have met that requirement. So pulling out those specific codes would be very beneficial. I'm looking at the RFA here. Sydney, what was the second part of that question?
The second part was also if there is one tracked in the number 4 through 10, does that local area need to be identified?
And I'm looking at the RFA now, and I see the comment here on only census tracts with the code 4 through 10 are appropriate for inclusion. And so again, as much as you can document to show that you're aligning with the requirements of the RFA, the better. And what I would encourage you to do is, if you still have questions, reach out to me afterwards, and we can make sure that we're getting your question answered.
Okay, next question. Is it reasonable for this RFA to support a pilot study, or should preliminary data already exist?
Yeah, so we have not funded pilot studies. However, we have had PDs who have done an initial proposal and have had a second phase to that. Sydney has been around with this program longer than I. Sydney, are you aware of a history of funding any pilot proposals? I know we've talked about that as a concept maybe in the future, but I don't think we've done that in the past. Maybe we have.
No, we
Okay.
have not done it in the past, but it's something that the community has brought up. So we've considered it, but it's not quite there yet.
Good. Thanks for Sydney, and thanks for asking that question. Again, we will make note that that is, as Sydney mentioned, something that the community have expressed interest in, and we will take that question as additional interest in the pilot option for the program.
What are the what are the priority areas other than opioid?
So I would direct your attention back to page 7, where it lists out those 5 objectives, information about value of good health at any age, all the way down through training of volunteers. So if you can document that the area you're thinking about is a significant health priority in a rural community, and you have community buy-in, then we will consider that project. I would encourage you again, if you go back and look at the abstracts that we funded over the last 5 years, which have all been under the current Farm Bill, you'll see kind of the variety of projects that we have funded under this program.
Can you remind us, were the past few years just focused on opioid prevention?
We highlighted over the past few years, we've highlighted opioid and broaden that out to based on, so I'll mention this, you have Farm Bill language, and each year you have an appropriation from Congress. And sometimes that appropriation comes with additional expectations, requirements. And so if you've been around for a while, you've noticed some of the language in the RFA go from at one point, a big focus on COVID was included in here. But also the opioid epidemic has been a big focus under this Farm Bill. And over the last couple of years, it's expanded to not just opioid, but substance use and abuse more broadly. So again, those are still priority areas for Congress and for the program, but the program is funding other rural health priorities as well.
Yeah, excuse me. The last question that I'm seeing here is, where can I find the codes for rural eligibility?
So those are in the RFA, and there is a link to them on page 11 of the RFA under project requirements, letter C. Well, perfect time. I think we are right at an hour, and really appreciate your participation here today. If you have additional questions, feel free to reach out to Sydney and I at any point. Send us an email, and we'll do our best to respond to you in a timely manner. If you've already asked a question and we said we'll get back to you, we need you to go ahead and initiate an email to us, and so that we can respond and do whatever research we need to do to get you that right answer. Okay, so again, thanks for your participation. Want to thank our ASL interpreter and our other support that we've had here, Anna Marie. So thank you all for your participation. Sydney, thank you. And again, this recording and the PowerPoint will be made available on our website in the near future. Thank you.